Hello guys, welcome back, and in this video lecture we will talk about hepatitis. The types of hepatitis includes a viral hepatitis, that is the today's topic. So we'll be talking about all the types of viral hepatitis starting from hepatitis A, hepatitis B, hepatitis C, D and E. And nowadays we also have a new type of hepatitis, that is hepatitis G. Hepatitis can also be caused by alcohol, that is alcoholic hepatitis, or non-alcoholic steatohepatitis. Hepatitis can also be autoimmune, and there can be neonatal hepatitis. The child is born with a hepatitis. So now this video lecture is all about the viral hepatitis. So viral hepatitis is A, B, C, D, E and G. Apart, all the hepatitis are RNA except one, that is hepatitis B. So hepatitis B is the only hepatitis that is a DNA virus. Apart from that, all the hepatitis are RNA viruses. So the mnemonic to remember the family of hepatitis that it belongs is private hospital favors the rich clients. So P for private. Hepatitis A is a picornaviridae family. Hepatitis B starts from H. It is hepatidinaviridae. Say hepatidinaviridae DNA. DNA word is there. So it is the hepatitis B that has got a DNA virus. Apart from that, all the hepatitis are RNA viruses. Then favors, F for flaviviridae family. R is hepatitis D. Remember, it is dependent. Hepatitis D is dependent on hepatitis B. So first the hepatitis B occurs. On the top of that, hepatitis D can occur, or simultaneously hepatitis B and D can occur. So but basically hepatitis D is dependent on hepatitis B, so it is a hepatitis that relies on hepatitis B. So D is dependent on hep B. Then C client is calciviridae. Nowadays we call this as the family of hepiviridae. So these are the families that it belongs to. I told you hepatitis B is the only DNA. Hepatitis A is RNA, C is RNA, D RNA, E RNA. All the hepatitis are RNA except the hepatitis B, that is a DNA virus. A and E are the one that are fecal-oral route transmission. Apart from that, all are parenteral route, or either it is a vertical transmission from mother to child. For example, B has got a vertical transmission from mother to child, or there can be sexual transmission or the parenteral transmission, that is from the IV route or the blood transfusion. So hepatitis A and E have got similar features because both of these causes gastroenteritis. And if you remember, I told you envelope, non-envelope are the viruses that causes gastroenteritis because they are not broken down by the bile salts in the body, so they causes gastroenteritis. So hepatitis A and E, because they are non-enveloped, they causes gastroenteritis. Hepatitis A and E are the one that are transmitted by fecal-oral route. So A and E have got a lot of similarities. Both are non-encapsulated, both are transmitted through the fecal-oral route, and both the clinical features are same, that is gastroenteritis. Apart from that, they are hepatitis A is the only one that is cultivable. Apart from that, all are non-cultivable. And the fulminant type, remember the fulminant type of hepatitis is hepatitis D. The most common cause of fulminant hepatitis, very important question for multiple choice questions for exam point of view. The most common fulminant type of hepatitis is hepatitis D. Fulminant type hepatitis is hepatitis D, the one that is dependent on hepatitis B. But if they ask most common fulminant hepatitis in pregnancy is the last one, that is E. There are 25% chances of having this fulminant hepatitis in the pregnancy, and this value is based on the articles. So carrier is hepatitis B, the one that is carrier. So this is all about hepatitis A, B, C, D, E. Now hepatitis E is a new kind of hepatitis, and it does not cause any infection in the human. But if it enters the human cells, then it is going to affect the mononuclear cells. So hepatitis B is not known to cause infection in the humans, but if it enters the human cells, then it is going to affect the mononuclear cells. The route of transmission is blood transfusion, and in the studies, it is shown that it protects against the HIV virus. So the viral hepatitis is hepatitis A, B, C, D, E and G. Till now what we have studied, A and E are the one that are transmitted through fecal-oral route, that are the one that are non-encapsulated, And this is the reason they are not broken down by the bile salts, and that is the reason they cause gastroenteritis. So they are associated with gastroenteritis. What we have studied is, one thing is incubation period that we have missed. So A and E, since both of these transmitted through the fecal route, both of these are non-enveloped, both of these causes gastroenteritis. So the incubation period is same for both of these, that is 15 to 50 days. Rest all is 50 to 150, 15 to 150, 50 to 150. Basically, rest all are 15 to 50, you can, or 50 to 150, you can remember. But 15 to 50 is the one that is incubation period for A and E. So hepatitis B is also known as Dane particle, and it has got a size of 42 nanometer. Hepatitis C has got a size of 60 nanometer, and A and E, because they are similar, so the size is also similar for this. 27 nanometer is hepatitis A and 30 nanometer is hepatitis E. So both of these are kind of similar. Let's talk about hepatitis A incubation period. What we have studied for A and E, both has got incubation period of 15 to 50 days. Rest all are somewhere around 15 to 150 or either 50 to 150. So basically 150 is the deadline. But for A and E, it is 15 to 50. The serotype is 1 for A. We have 6 genotypes of hepatitis A, and the genotype most common in human is 1, 2, and 3. 1 is most common in worldwide. 3 most common in India. And since they are susceptible to boiling, chlorination, autoclave, and formalin, so they can be killed by boiling, they can be killed by chlorination, they can be killed by autoclave and the formalin. And that is why we do autoclave the instrument. We boil everything that comes in contact with the hepatitis patient. Or in the normal surgery OT, you boil everything, you chlorinate everything, you autoclave everything. This is the reason, because we don't know if the patient has got hepatitis or not, and hepatitis can be killed by all of these, for boiling, chlorination, autoclave, and formalin. See, we are talking about hepatitis A. Remember, hepatitis A, the transmission is fecal-oral route. Hepatitis A is non-encapsulated, and hepatitis A has got association with the gastroenteritis. So all the clinical features are going to resemble with the features of gastroenteritis. That is, patient will have fever, anorexia, nausea, vomiting. The patient is going to resemble the symptoms of jaundice, and there is going to be, the symptom of jaundice is what? Dark urine and pale feces. So what happens? The symptom of jaundice, the patient will show, the symptomatic phase is basically showing the symptom of jaundice, that is dark urine, pale feces. So what happens? Before 2 weeks prior to the jaundice symptoms, there is going to be hepatitis A virus shedding in the stool. And 2 weeks prior to the jaundice, that means 2 weeks prior to showing the symptoms, there is going to be shedding of hepatitis A in the potty, hepatitis A in the feces, and 2 weeks after the jaundice, that is symptoms, it is going to show hepatitis A virus in the fecal, hepatitis A virus in the potty. So basically, hepatitis A virus shedding in the stool comes 2 weeks prior to the jaundice. That means come 2 weeks prior to the onset of symptoms, and 2 weeks after the onset of symptoms. And IgM, immunoglobulin M, appears with the onset of jaundice. So when the jaundice or when the symptom occurs, IgM, immunoglobulin M appears, and 2 weeks later, you can see the IgG. So the first thing that shows is IgM, then comes IgG. And if you see in the major cities, we have MG road, you can remember. So M comes first, G comes later on. With the onset of jaundice, IgM, immunoglobulin M's are seen, they appear, and 2 to 4 weeks after this, we see immunoglobulin G. For acute hepatitis, we do not require any liver biopsy. But if you do biopsy at all, what you will find that hepatitis A shows increase in the plasma cells. So that is a clinical feature of hepatitis A. Since we are studying hepatitis A, there is going to be increase in the plasma cells that is seen in the biopsy. We do not require biopsy, liver biopsy for acute hepatitis. We only do to see the grading and the chronicity of the chronic hepatitis. But for acute, we do not require any biopsy. But if at all you do a liver biopsy, you will find increase in the plasma cells. But liver biopsy is not recommended for acute hepatitis. Hepatitis E, see, A and E we are studying both because the features are similar for both A and E. For A, it shows increase in the plasma cells, and for E it shows the stasis of the bile, or there is slow downing of the bile, that is shows cholestasis. So bile plugs are formed, bile plugs. So what do you see in the liver biopsy? For A, increase in the plasma cells. If you make a table for hepatitis A and hepatitis E, all the features are similar. But the liver biopsy in the hepatitis A shows increase in the plasma cells, and for E, it shows cholestasis, which is the bile plugs. You see the bile plugs, stasis of the bile. For vaccines, we give vaccines 2 doses given at 6 and 12 months apart, and the vaccine is given as the IM dose. So this is inactivated formaldehyde, that is given in 2 doses, that is given at 6 months and 12 months apart, and given to the people above 12 months of age. Then we have live attenuated vaccine, which has got 2 strains, OH2 and OLA1 strain. Immunoglobulin are given for all the unvaccinated contacts. See, if you have come in contact with the exposed person, come in contact with a hepatitis patient, and you yourself are unvaccinated, then we go for this immunoglobulins. So they are given less than 2 weeks of exposure. Suppose if you have not got hepatitis vaccination done, and you are working in hospital or working in a clinic, and you come across with a needle stick injury of a hepatitis patient, accidentally of a hepatitis patient, you have got a needle stick injury, and the person, you are unvaccinated yourself, then within 2 weeks of exposure, you take this immunoglobulin. Apart from that, you get the vaccination at 0, 1 and 6 months. So 0, 1 and 6 months, you take vaccine. Apart from the vaccine, you also get the immunoglobulins. You also take the immunoglobulins for all the unvaccinated contact or all the unvaccinated exposure. This is about hepatitis A. Then we talk about hepatitis E. Hepatitis E, it is similar to hepatitis A. It is going to cause acute hepatitis. The route is oral route. And if you remember, hepatitis A, B, C, D, E, private hospitals favors rich clients. So private hospital favors rich clients. Hepatitis A belongs to Picornaviridae. Hepatitis B belongs to Hepatadenoviride. So it has got DNA word in it. Hepatitis C belongs to Flaviviridae family, and hepatitis D is dependent on the, it relies on the hepatitis B, and C is Calciviridae. So hepatitis E actually belongs to Calciviridae, but nowadays it is said to come under the family of Hepaviridae, which is again RNA. Only the hepatitis B is DNA. Apart from that, all the hepatitis are RNA. In the pregnancy, the fulminant hepatitis, 25% it causes fulminant. Most common cause of fulminant hepatitis in the pregnancy is associated with hepatitis E. And if I say only fulminant hepatitis, most common cause is hepatitis D. But if I say fulminant hepatitis in pregnancy, then it is hepatitis E. Supportive treatment we give, and vaccination is available in China, that is a recombinant capsid protein. Now coming to hepatitis B, we have finished with hepatitis A and E. Both are fecal-oral route, both are associated with gastroenteritis. Now, hepatitis B is also known as Dane particle. Remember, complete hepatitis B is known as Dane particle. Hepatitis B is very important for exam point of view, and it is the most common type, right? And there are 8 genotypes starting from A to H. The most common or prevalent in India is genotype D. Then for serotypes, in the North and South India, we have serotype AYW, and in the East India, we have ADR. It belongs to Hepatadenoviride family. Hepatadenoviride family. It has got DNA word in it, so it is the only DNA hepatitis. But the DNA is partial double-stranded. If you remember, what we have studied, that all the DNA viruses has got double-stranded DNA, with the exception. What is the exception? It is the parvovirus. Parvo, if you remember, parvo is Paro. From Devdas movie, she remains single, so it is the single-stranded DNA, except the parvoviridae that has got a single-stranded DNA. One more exception that we are going to talk right now is hepatitis B. Hepatitis B, I'm going to write hepatitis B virus as HBV. Hepatitis B virus has got partial double-stranded DNA. It is not the double-stranded DNA. One strand is complete, one strand is incomplete. So normal DNA, we have double-stranded, one strand is plus strand, one strand is minus strand. So in the normal DNA, we have double stranded, one is plus strand, one is minus strand. The plus strand makes the proteins forward. But for hepatitis B virus, there are two linear strands. The complete strand is minus, this is complete strand, and incomplete strand is plus strand. Incomplete is plus strand. So coming to the genome, it has got the genes PCSX gene. So the P gene is responsible for three enzymes. One is the DNA polymerase. P has got DNA polymerase. Remember, P for polymerase, very easy to remember. And it is the largest gene. It has got two more enzymes. One is reverse transcriptase. Now you will be telling, ma'am, it is a DNA virus and you are talking about reverse transcriptase. When we are talking about the pathology, then we will talk about this reverse transcriptase again, and also RNAs. Though it is a DNA virus, but it has got these enzymes. The next gene is core gene. See, this is the core gene. If you can see this green color layer, it is the capsid. This is made up of core gene. This is made up of core antigen. So there are two areas. One is the core area, and this is the core area, and we have the pre-core area. So the core area codes for the C antigen, and pre-core area, before the core, we have E antigen. So inside is the core area, guys. Inside is the core area. This is the core area, the one that is inside. This is core antigen or C antigen. And the pre-core area, before the core area, is the E antigen. So remember, the core area is C antigen, and pre-core area, this pre-core area is E antigen. So inside we have C, outside pre-core we have E, and on the surface we have surface antigen, SHBS surface antigen on the surface. So you can see this is the envelope. This part is the envelope and it is the surface antigen. This part is the surface antigen. Surface antigen has got different sizes. You can see one is long, this one is long, this one is short, this one is medium size. So basically you have different types based on the sizes. You have small, medium or large size or surface antigen. This surface antigen is also known as Australian antigen. See, it forms the envelope, so it is present on the surface. So this is the surface antigen, which is known as Australian antigen. The surface antigen, we have small size, medium size, large size, and you can remember surface antigen as HBsAg. That is hepatitis B surface antigen. Then we also have a HBx gene that is responsible for causing cancer in case of hepatitis. So it is a cancer of the liver, that is hepatocellular carcinoma, which is caused by hepatitis B virus. The complete hepatitis B virus, which has got a surface antigen, which has got a core antigen, which has got a pre-core antigen. This all the antigens of hepatitis B virus is known as a Dane particle. So what is a Dane particle? Dane particle is the full virion. It is the full virion, guys. It is a full virion that has got genome plus that is going to cause infection. If surface antigen is small or if the surface antigen is medium, that is compared to the full virion, then see, suppose for example, if it is spheres or tubular, or if it is filamentous, then no genome, no infection. Full infection means infection is there in the full Dane particle, the full virion of the hepatitis B that is going to cause the infection. Full virion, that means the complete hepatitis B, that is the Dane particle, is going to cause infection. If the size is small, if the surface antigen is not present, if the surface antigen is small, then it is not going to cause the infection. Full full Dane particle causes infection. Now coming to modes of infection from the blood products, this is hepatitis B. Remember, hepatitis B, the transmission can be sexual, parenteral, or from mother to child, vertical. So what we have studied from the parenteral, from the blood product, from percutaneous, from blood stick injury, that is parenteral. Then from sexual intercourse and the vertical transmission from mother to child. So needle stick injury can cause hepatitis B. So you have to be very careful while you are treating the hepatitis patient, and remember that you yourself are vaccinated from hepatitis. So needle stick injury if you remember, just write blood stick injury, BCI, needle stick injury. If you write blood stick injury as BCI, so B for hepatitis B, C for hepatitis C, and I for HIV. So it is going to cause 30%, 3%, and 1%. The chances of transmission from a needle stick. Now, if you see how this is going to cause infection, the first we have is hepatitis B virus virion. This is the complete virus, complete virion, which is known as Dane particle, that is going to cause the infection in the person, right? Dane particle. It enters the cell through endocytosis. Once it enters, there is uncoating. You can see this blue color is removed. There is uncoating of this, uncoating. So the surface antigen here, if you can see, surface is removed, core antigen is also removed. There is no capsid. If you see, the capsid is also removed. And what we get only is the DNA part. So uncoating of the virus is done, and you can see the partial double-stranded DNA here is exposed. So partial, one is complete minus strand and incomplete was plus strand. So you can see there is a partial DNA strand that is exposed, and this DNA is known as CCC DNA. This DNA now, when it is completed, see, this is a partial DNA, then it is completed. This DNA is completed, both of the DNA, and this is known as CCC DNA, which is covalently closed circular DNA. So you can see this partial DNA when it gets completed. When it gets completed, this is known as covalently closed circular DNA, since it is circular in shape. Then the translation occur from this DNA, RNA synthesized. Which type of RNA? It is pgRNA, pre-genomic RNA. Now, initially the capsid is made around this pgRNA, which is pre-genomic RNA, but it is RNA. See, it is a RNA I am talking about. But hepatitis B, I told you, it is the only DNA virus. Apart from that, all the hepatitis are RNA, right? It is a DNA virus. So, with the help of this reverse transcriptase, this RNA is converted to DNA again. First strand that is synthesized is a minus strand. First strand is a minus strand that is formed, and then the plus strand is formed. Here the plus strand is also formed. So first the minus strand is formed, then the plus strand is formed, and in the endoplasmic reticulum it is assembled. So if you see this step, the first one is entering of the hepatitis B virion. Then uncoating of the hepatitis B virion occurs. Then the DNA is exposed. This is a partial DNA. The partial DNA becomes complete DNA, and then with the help of transcription, we have this rRNA, then RNA, then we have translation occurring. Then it is assembled and packed. Then the minus strand DNA synthesized with the help of reverse transcriptase. Here, this reverse transcriptase plays important role. So minus strand is first synthesized with the help of reverse transcriptase. Then the plus strand is synthesized with the help of DNA polymerase. You remember the P gene. P gene has got both for DNA polymerase as well as reverse transcriptase. Then in the endoplasmic reticulum, it is assembled. So this is how it forms. So pre-genomic RNA is formed. Then with the help of reverse transcriptase, minus strand of DNA is synthesized. Then with the help of DNA polymerase, plus strand is synthesized. So first strand that is synthesized is the minus strand. Now coming to lab diagnosis, the first virological marker in the blood is hepatitis B virus DNA. Now remember, if I ask you this question, that first antigen to appear in the blood is surface antigen. But when I say virological marker, then it is DNA. If I say antigen, then it is surface antigen. So remember, first antigen that appears is the surface antigen, that is the enveloped code. So first antigen to appear is hepatitis B surface antigen. The first antigen to appear in the blood is surface antigen, and this antigen appears 2 to 6 weeks before the onset of symptom. Before the person shows jaundice, symptom of jaundice, before 2 to 6 weeks, you will see the surface antigen appearing in the blood. And in fact, it stays in the blood for 1 to 2 months after the onset of jaundice, after the onset of symptoms. So if this is the symptom period, this is the period that patient is going to show the jaundice symptoms. Before 2 to 6 weeks, you will see the surface antigen appearing in the blood. And after 1 to 2 months, you will see that surface antigen is still in the blood. So it stays for a long period of time. And that is why we call it as the epidemiological marker. You can tell that if the person has start with the onset of the infectivity. But if I say which tells about the high rate of infectivity. So high infectivity is indicated by HBe antigen. This is pre-core antigen. So what they see, we start from the outside, goes inside. First one outside is surface antigen. Then we have pre-core antigen, which is HBe antigen. Then inside we have is the core antigen, which is HBC antigen. So the pre-core antigen, HBe antigen, appears shortly after the surface antigen. And this HBe antigen tells about the infectivity. Infectivity has got E word in it. So remember, it is infectivity, tells about the infectivity rate. If this HBe antigen is in the blood, that means the patient is in the high infectivity period. And if it is low, that means the patient has started developing the antibodies and the infectivity period is low. So basically, this tells about the infectivity rate. Infectivity rate is calculated, or it is assessed by HBe antigen. Onset of infectivity is by surface antigen, and it is also known as epidemiological marker is anti-HBs, which is surface antibody. So if there are antibodies against HBe, that means there is decrease in the infectivity. If the antigen HBe present, that means it is the patient is under the high infectivity. Then coming to core antigen. So this antigen is stuck inside the core, right? And therefore it is not detected in the blood. Then how are you going to see the antibodies that are made against this VC? So immunoglobulin M covers the window period. First, which one is the first one to appear? Remember MG, I told you. First is immunoglobulin M appears, then the immunoglobulin G appears. Remember MG, I told you. Also in the acute hepatitis, you will find IgM. In the chronic hepatitis, you will find IgG. Why? Because IgG, that is anti-HBC, that is the HBC core antibodies, are formed in long-term period, while short-term initially IgM is seen. So what is a marker window period? See, to understand the marker window period, first understand this thing, that in the patient, the surface antigen, this is the surface antigen. Surface antigen goes away here at this particular period, and the surface antibody comes so late. So there is a period of window, there is a gap that is between the antigen and the antibody. This is antigen, this is antibody, HBs, anti-HBs, that is antibody. So between the antigen and the antibody, there is a gap that is known as window period. This is the window period. And if you find in between this window period, you can see this this is immunoglobulin, that is IgM. So immunoglobulin M, which is anti-HBC, which is the antibodies that are for hepatitis core antigen, for core hepatitis core antibodies, that is IgM, that appears. This IgM covers this window of infectivity. This is the window of infectivity, and it is covered by immunoglobulin M. So anti-M, so IgM, anti-HBC, that is the antibody that covers the window of infectivity. So marker of window period is what? Marker of window period is immunoglobulin M, which is a type of antibody to core antigen. So that means antibody to core antigen, which is hepatitis BC. Hepatitis B core antigen, antibody to hepatitis core is immunoglobulin M, that is the marker of a window period, because it covers the window of infectivity. See, IgM is covering the window of infectivity. Remember IgM. Then IgG comes later on. First comes IgM. So if you see, this is the initially is the antigen, Then comes the antibody. Here is the antibody. So first one to appear is surface antigen. So I'm going to write surface antigen, that is the first one to appear. Then comes the pre-core antigen, that is HBe antigen. Then comes the immunoglobulin M. Then comes the immunoglobulin G. And both of these are antibody to core antigen, that is HBC. Anti-HBC. That is immunoglobulin, that is antibody to core antigen. First one to appear in the blood is surface antigen. Then comes the pre-core antigen and then comes the core antigen. Very easy. Starting from outside, go inside. So for acute hepatitis, what we find is surface antigen. Then we see the pre-core antigen and then the immunoglobulin M. Remember, for M, Mg, first write M, then write G. M is acute. In the acute hepatitis, you will find IgM, and in the chronic hepatitis, you will find IgG. For chronic hepatitis, what you find? For chronic hepatitis, I'm going to write it here. For chronic, you will find surface antigen, pre-core antigen, and IgM. Then if the pre-core antigen is positive, that means if you find hepatitis E antigen, that is HBe antigen, that means the person is going to have high infectivity. So high infectivity, you will tell that if the patient is having SEMA, that is surface antigen, pre-core antigen, immunoglobulin, and the antibody, that is immunoglobulin M antibody. So if this is, that means the person is having high infectivity acute hepatitis. For chronic, you will find IgG. For acute, you will find IgM positive. For recovery, all the antibodies you will see, that is antibodies against surface antigen. So I'm going to write antibody here. If I write anti-HBS, that means the antibody. Also antibody against pre-core antigen HBe and anti-HBC, that is core antigen. So anti-HBC is what? There are two: immunoglobulin M, immunoglobulin G. Immunoglobulin M is seen in the early stages, that is in the acute hepatitis. Immunoglobulin G is seen in the chronic hepatitis. Very easy. And what is the marker of window period? Marker of window period is immunoglobulin M, because between this window period, between the antigen and the antibody, you will see these immunoglobulin M. So the marker of window period is immunoglobulin M. Now hepatitis in the pregnant woman. If the mother has got hepatitis, that is E, pre-core antigen is positive. If the mother has got pre-core antigen positive, that means 90% risk of transmission. See, I told you, pre-core antigen, HBe antigen means there is high infectivity. So the high infectivity, the risk of transmission is 90%. If the antibodies are positive, that means low risk of transmission. Why? Because there is less risk because the antibodies here are produced. If antigen is positive, that means high infectivity. This you need to remember. When a neonate is born with hepatitis, so in the one arm, you put the vaccine and in the other arm, you put the immunoglobulin. Now talking about vaccine of hepatitis B, it is prepared in the yeast, that is Saccharomyces cerevisiae. And hepatitis B vaccine, it is a recombinant killed vaccine. We give at a dose of schedule of 0, 1 and 6 months. We follow this. Now the important thing that you need to remember is, if you see the antibody titer of more than 10 international unit per ml. So if you see the antibody titer of more than 10, you will find in the vaccinated individuals. So in the vaccinated person, you will find more than 10. If the person is vaccinated, you do the antibody titer, and if the titer comes more than 10, that means the person is responder. That means antibodies have formed against this hepatitis B. If the person is vaccinated, but still the antibody titers come less than 10. See, the person is vaccinated. I told you in the vaccinated, it comes more than 10. But if you do the antibody titer and if it comes less than 10, then the person is non-responder. That means vaccination is done, but antibodies have not produced in this individual. So this is non-responder category. So we are going to see a table for vaccination. This is from a needle stick injury. If accidentally you have come across a needle stick injury, If the source, that means if the person from which you have got needle stick, the surface antigen is positive for this, the surface antigen comes negative from the source, and the source you do not know about the surface antigen, then it is unknown. And this is your category if you are unvaccinated. If you are vaccinated but you are responder, that means if you are vaccinated and the antibody titer come more than 10 for you. If you are vaccinated but still the antibody titer come less than 10, that means antibodies have not formed. So that means you are vaccinated but antibodies have not formed. So this is the you, and this is from the source you have accidentally come across the needle stick injury. So if from the source you have accidentally come across needle stick injury and from the person's surface antigen is positive and you yourself are not vaccinated, so you need to get the immunoglobulin done and also vaccination at 0, 1 and 6 months. If you are unvaccinated and if this from the source the surface antigen comes negative, then you need to go for vaccination 0, 1 and 6 months. If you yourself are unvaccinated and the source is unknown, then also you get the vaccination done because you yourself are unvaccinated. So 0, 1 and 6 month vaccination. See, if you are vaccinated, you are a responder. That means antibody has developed. So you need not to do anything if the source has got surface antigen or not. Or if the source is unknown, you need not to do anything because you are a responder, antibody titer come more than 10 for you. You're vaccinated and you have antibodies in your system, so you need not to do anything. Now, if you are vaccinated and antibodies have not formed in your body, that means you are a non-responder category. That means the antibody titer come less than 10. In that case, if the source has got surface antigen positive, you need to get the immunoglobulin done, plus you need to get vaccination at 0, 1 and 6 months. If the source has got no surface antigen, you need not to do anything. And if the source is unknown, you need not to do anything. But some hospital has got variation. For safe side, you may get the vaccination done. Now coming to the carriers for hepatitis B, we have two kind of carrier. One is the simple carrier. Another one is the super carrier. Super carrier, you know what? The HBE, the pre-core antigen, if it comes positive, then it is a super carrier because high infectivity. See, I told you, wherever HBE antigen comes, there is high infectivity. It tells about the infectivity dose. So that means the person is highly infective. So the person becomes super carrier. And for carrier, the surface antigen comes positive for more than 6 months, beyond the 6 months. Now we are left with hepatitis D and C. So let's talk about the smallest one, which is hepatitis D. Hepatitis D is dependent on hepatitis B. Hepatitis B. Another thing that we have studied about hepatitis D, it is the most common cause of fulminant hepatitis C. Most common cause of fulminant hepatitis is hepatitis D, but most common cause of fulminant hepatitis in pregnancy is E, that is 25%. So if it is asked most common cause of fulminant hepatitis, it is hepatitis D. Most common cause of fulminant hepatitis in pregnancy, if I write, then pregnancy E, that makes it hepatitis E. So there can be two kinds of infection. One is co-infection. That means hepatitis B and hepatitis D both are occurring simultaneously, both are occurring together. So that is known as co-infection. As the name suggests, co means both are occurring together. That is usually seen in IV drug abuser where it causes fulminant hepatitis. Another one is super infection. Super added is what? First the person gets hepatitis B, then the person gets hepatitis D. That is known as super infection, and this is the most common infection in the fulminant type. Now coming to last category, that is hepatitis C. So hepatitis C has got no vaccine. Why? Because it is highly mutable virus. It keeps on changing its shape, and that is why we have a term that is known as quasi-species. Quasi-species means by the time your body makes antibodies against this hepatitis C changes its shape. So that is why we say it quasi-species. It is the most mutable virus and the mutation is T2. Then there is no vaccination, I told you, because it keeps on changing shape and the route is parenteral route, that is the IV or blood transfusion. So lab diagnosis, you see IgM antibodies, that is the C-type hepatitis, or you can do a tri-dot testing for hepatitis C. But the diagnostic test of choice is hepatitis C RNA-PCR polymerase chain reaction. This is the diagnostic choice. If you see pathologically, compare acute and chronic hepatitis. See, I told you in the hepatitis A, you can see increase in the plasma cells. And in hepatitis E, which is also another causing acute hepatitis, you can see the stasis of the bile, cholestasis, that is bile plugs are found. Bile stasis is seen. So hepatitis A that causes acute hepatitis, hepatitis E that also causes acute hepatitis. If you do the liver biopsy, you will find increase in the plasma cells. Though liver biopsy is not indicated for acute hepatitis, but if at all you do the liver biopsy, for hepatitis A, you will find increase in the plasma cell. For hepatitis E, you will find cholestasis, that is bile plugging, bile stasis. And you can also see concealment bodies in case of hepatitis, acute hepatitis, or the starting stage of hepatitis C, you will find concealment bodies. So basically, to be very appropriate, concealment bodies are seen at the starting stage of hepatitis C. Starting of C for concealment, C for hepatitis C. And these are the apoptotic bodies. These are the necrotic bodies. So spotty necrosis is seen, and then there is dropout necrosis. Because there is necrosis, lot of cells are dying. See, I told you, these concealment bodies are apoptotic bodies. Apoptosis means cell death. So because there is a lot of cell dying, then the macrophages come and eat this necrotic cell, and therefore you will see this Kupffer cell hyperplasia. In the liver, we have macrophages known as Kupffer cells. So concealment body, these are the apoptotic bodies. You will see these concealment bodies as these are the hepatocytes. If these are the big hepatocytes with a ballooning degeneration, inside these hepatocyte, you will find these concealment bodies. These concealment bodies, you will find they are extremely pink color bodies. So concealment body has got three features. One is cell shrinkage. This means if this is a big size hepatocyte, you will find these concealment bodies are very small. And they are very dark pink. So the cytoplasm is pink, darkly pink. And the nucleus is also very blue color nucleus. So this is known as concealment bodies. See, these are the hepatocytes, very big cells. And these are the hepatocytes. You can see this hepatocyte, this hepatocyte. Now you can see these are the hepatocytes, very big cells, right? Big cells. And between these hepatocytes, you can see this pink color. You can find this pink color, very darkly pink and darkly blue color nucleus. So this is a apoptotic body. Here also you can see this apoptotic body, very small, these big hepatocytes, and in between these big hepatocytes, you can see small apoptotic body that is known as concealment bodies. So you can see the concealment bodies in acute hepatitis. In the chronic hepatitis, in the ETO cells or the stellate cells that are present in the liver in the space of Disse, it is these space of Disse or the stellate cell, basically I must say, they releases TGF, which is the most fibrogenic cytokine. And TGF beta, how you can remember? TGF beta is B for बहुत and F for fibrosis. So it causes बहुत सारा fibrosis. So this TGF beta, most fibrogenic cytokine, this causes the fibrosis. So it further causes the chronic hepatitis. So this is the pathogenesis of chronic hepatitis, ETO cells or stellate cells in the liver. There is a space of Disse in that. It releases TGF beta, and this TGF beta causes the fibrosis. So this is chronic hepatitis. Chronic hepatitis, and the hepatitis B, you will find the surface antigen that is known as Australian antigen. And in this, you can find this ground glass hepatocytes. If you see these hepatocytes, they're diffusely pink. So if you see this particular hepatocyte, diffusely pink color. See, this is white color hepatocyte, but you will find this diffusely pink hepatocytes, completely pink color hepatocytes, extremely pink color. This gives the ground glass hepatocyte, and this is stained by Orsin Shikata stain. This is ground glass hepatocyte, that is the surface antigen. Hepatitis C, if you see, this is a picture of hepatitis C. You can find these macrovesicular steatosis, that is the fatty changes that are macro, big vesicles. You can see these big vesicles. This is the fatty change. These big vesicles are the macrovesicular. These are the big fat cells. This is the fatty liver, and here you can see the follicular lymphoid. So blue color aggregates, blue color lymphocytes, so lymphoid follicle. Lot of lymphocytes, blue color aggregate, you can find this is hepatitis C. Hepatitis D, since I told you it is the smallest genome, it relies on hepatitis B. So remember, it relies on hepatitis B smallest genome. So there are small vesicles, that is microvesicular steatosis. Macrovesicular hepatitis C, micro hepatitis D. Remember, biopsy of the liver is not recommended for acute, but in chronic, for staging and grading, you need to do the biopsy. So for staging is based on how much fibrosis have occurred, and grading is based on how much inflammation and necrosis has occurred. How to remember this? Write GIN. That is, grading is based on inflammation and necrosis. This is how you can remember GIN. So grading is based on inflammation and necrosis, and staging is based on fibrosis. Now let's wrap it up and talk about the most common things or questions that have asked in the exam. Most common cause of sporadic acute hepatitis in India, it is hepatitis E. Fulminant, most common cause of fulminant viral hepatitis. Most common cause of fulminant viral hepatitis is hepatitis D. But if it is asked fulminant virus hepatitis in pregnancy, 25% it is hepatitis E virus. Most common cause of chronic hepatitis is of course hepatitis B. And most common transfusion related hepatitis, it is both B and C, but because B is the most common, so we write hepatitis B. Maximum risk and potential of chronicity. See, most common chronic is hepatitis B, but which has got maximum risk and which has got maximum potential for chronicity, it is hepatitis C virus. Most common cause of carrier state, we have already discussed, it is hepatitis B virus. It has got two kind of carrier, simple carrier and super carrier. Super carrier has got what? Hepatitis E antigen. It is the E antigen that makes it a super carrier. Most common cause of viral hepatocellular carcinoma, it is hepatitis B virus, and most strong association with the hepatocellular carcinoma. Strong association it is asked, then it is hepatitis C virus. Now, hepatitis B virus is associated with polyarteritis nodosa, PAN, and also membranous glomerulonephritis. Hepatitis C is most commonly it causes mixed cryoglobulinemia. And it is associated with a skin lesion, that is lichen planus. In the lichen planus, we see the colloid bodies that we studied in the oral pathology and medicine. And it is also associated with membranoproliferative glomerulonephritis. So this is related to hepatitis. We have studied that hepatitis B is the only DNA. All the hepatitis are RNA, and all the features of hepatitis, if you watch this lecture 1 or 2 times, you can easily remember all the features, all the structures and the important points. So this is about hepatitis. All the best.